have to pass the bill so that you can find out what is in it.
Around this chamber are looking upon us.
Okay, is that...
Somebody knows where Lotus Sanchez is?
But we can't say.
He's got the security line at
Okay, let's just go. Yeah, who is testing?
It must be big.
That's it.
Everybody knows about.
Yeah, it's going to be, this is not going to be about another 40 minutes. Okay, 40, 50 minutes.
Alright, so Kate,
Yeah, we're good.
you can let me know?
Yeah, so it'll be about 40 minutes, and you have 15 minutes of calls.
What do you think they're going to do it? They're going to do it.
You guys, could have had some hot. I want to thank my outstanding Vice President, Joe Biden, and my wonderful Secretary of Health and Human Services, Kathleen Sebelius, for their fantastic work on this issue. I want to thank the many staffers in Congress, and my own incredible staff in the White House, who have worked tirelessly over the past year with Americans of all walks of life towards a reform package finally worthy of people who were sent here to serve. All right, the party's upstairs. Whenever you have people rounded up, and some folks can come with me now.
Assistant called and said the president wants everybody to come back to the White House and watch it together, and that means everybody from the most junior staff person who worked on it to the vice president. And so everyone was together and watched the vote.
Members will record their votes by electronic device.
Sitting in the Roosevelt Room, the president, the vice president, we sat, there was a small bit of anxiety as we watched the votes tick up.
It is a 15-minute vote.
We've had victory snatched from us before.
This vote, the yeas are 219, the nays are 212. Motion adopted.
The 216th vote comes over. A big cheer erupts.
219 to 212. No votes for Republicans. All Democrats, no Republicans. This is a huge victory for this president. For decades they've been trying to do it. It has now been done.
He invited everybody up to the Truman balcony to celebrate. And this is about 1 o'clock in the morning. As the crowd started to weed out, and the president was so happy that night, and he was just totally joyful and in a great mood. I asked him, I said, how does this night compare to election night? And he looked at me and said, Valerie, there's just no comparison. Election night was just about getting us to a night like this.
Good evening, everybody. This legislation will not fix everything that ails our healthcare system, but it moves us decisively in the right direction. This is what change looks like. Let's do this. We're gonna keep doing it. I got it. I filled up. I gotta sign it 22 times. Got a lot of pens, man. She wrote that the other.
Ladies and gentlemen, please take your seats. The program is about to begin.
The reason we made history today was because of you guys.
The White House is stepping in once again when it comes to the way Obamacare is being implemented. First, it was a decision to delay the employer mandate, and now the president has personally intervened to allow the government to continue helping members of Congress and their staff when it comes to paying their premiums. Members of Congress were furious that they would soon be forced to pay thousands of dollars.
Members of Congress were furious that they were going to be held to the same law that they passed, right?
It's odd.
It is odd. They got so angry. And by the way, so the president goes up to see the Democrats this week. What is the first thing, Mike, they're yelling at him about?
What about my premiums?
Exactly. You mean we're going to have to live by the laws that we passed on to the American people?
Oh, we're going to have to worry about the same things that our constituents are forced to worry about? Please.
I'm sorry, Mika.
No, actually, they take their vacations when they're
5 weeks.
Yes, okay.
5 weeks.
Usually when things are just like happening, they leave. All right. They would soon be forced to pay thousands of dollars in additional costs through Obamacare's insurance marketplaces. Some even warned that lawmakers would leave Washington and their staffers would look for work outside of government service. Really?
So hold on a second. So hold on. So Harold, when small business owners were telling the Obama administration, you know, if you do this, we're going to lose some of our best employees.
Really?
Employees. And the administration said, oh, no, that you all are so crazy. What are you talking about? It's happening on Capitol Hill. They said, we're going to lose our best staffers if Obamacare is implemented up here.
Come up with a different set of answers or excuses for why.
It's awful.
The three scariest words on Capitol Hill among the staff and among the elected officials are the private sector.
Yeah.
Forced to go look in the private sector.
So what's the White House
But now
doing
the administration is set to announce a plan that lets the federal government continue paying its share of congressional health plans. In turn, those employees would be ineligible for any tax credits or subsidies.
It's crazy. You know, one of the first things we passed when we got up there, in fact, it was the first thing. You remember Chris Shays?
Yes.
Great guy, great congressman from Connecticut. Love Chris. We passed what was called the Shays Act, and it was radical. First day we were up there. And it made Congress live by the same rules that the rest of the country lived by.
That's terrible.
That didn't last long. And so now, seriously, how embarrassing that they pass this law. And again, small business owners have been complaining about it.
This is one of those things that, you know, you and I understand you're going to hear come next summer and next fall as these campaigns get going.
This is the 30-second ad.
Right. It's one of those things that's easy to explain, easy to convey, and it's hard to dispute. There may be some caveats to this. I don't know what they are, but this is an easy one.
Listen, the 30-second ad, how you would not like and I would not like it. Congressman Scarborough voted for Obamacare to raise your health premiums, and yet he had the president exempt him from Obamacare. Let's exempt Congressman Scarborough from Congress or something like that. This is set up so easily for these Democrats who pass this.
Please do that again.
Shouldn't you all get rid of the Capitol Hill exemption?
There isn't a Capitol exemption.
There is a Capitol Hill
exemption.
exemption.
No, there's not. No, there's
because
not.
you guys were afraid of a brain drain.
No, you're not. This is not true.
Staffers who work either directly for the committees as opposed to being a staffer for Congressman Gifford or French or Senator Charles or King, the people who work for the committees and leadership staff who aren't technically directly assigned to the actual offices, those are the people who wrote the bills. They managed to exempt themselves from actually having to be treated as the rest of us. So that's one group.
They passed Obamacare, but now Congress wants an exemption from it. Lawmakers are holding bipartisan secret meetings to try and find a way to exempt themselves and their staff from part of President Obama's health care law. With more on this, Ovik Roy, senior fellow at the Manhattan Institute. Ovik, can you say hypocrisy? Look, these are the people who pass the legislation. They think it's good enough for us, but not good enough for them. What do you make of it?
Well, a lot of people on the Hill are really scared because a lot of these staffers, particularly who work for Congress, they're young. And one of the things about Obamacare is that it dramatically drives up the cost of health insurance for young people. So a lot of these people are going to be exposed.
I take your point, and I understand it, but the same thing holds true for the rest of America. If people in Washington, D.C., making pretty good dough can't pay for Obamacare, how in the heck are people across the country going to pay for it?
I think that's absolutely right, Jerry, and that's why this is one of the most important provisions in the law. So it wasn't supposed to be in there. What happened was in 2009, when Obamacare was winding its way through the Senate, Republican Senator from Iowa, Chuck Grassley, slipped this amendment into the bill, and all the Democrats had to vote for it because they didn't want to look like hypocrites. And now they're stuck with this amendment that says that members and their staff have to be on the Obamacare exchanges.
Well, here's what you wrote in your story. I thought you put it eloquently. You said, look, the idea was simple, that if Congress was going to impose Obamacare upon the country, it should have to experience what it is imposing firsthand. Oh, Vic, you've covered this so intensely and you've watched it so closely. I have to say, so many unintended consequences. Now Congress won't even abide by it.
Here's what's in the bill.
Nancy Pelosi specifically asked Barack Obama
let me
for
ask
an
you
exemption.
this question, Joe. Who are the only people in America that are required to purchase their insurance on the exchange? Who are the only ones?
Who? Congress.
Congress and their staffs. We are the only ones required to purchase our insurance on the exchange. That's what's in the bill.
Pat from Powell, who thanked me for my efforts to make sure that Washington was not exempt from Obamacare. Pat said regardless of how many millions are satisfied with Obamacare, the fact remains that senators and congressmen should not be exempt. Diane from Lovell said she didn't understand why Congress has to pass laws to force themselves to obey laws. They've already passed. Clark from Story said, let Congress exempt themselves from it and then face voters next year as it takes full effect. And that's absolutely right. In the Wyoming legislature, we come under the laws that are passed there. That's how it ought to be with Congress. Congress should not get a special deal. And I worked hard in committee to make sure that Congress and their staff would be under whatever bill we passed, that we would feel the same pain as the rest of America. As it turns out, the president during the recess said, no, that won't be necessary. You won't have to do that. Well, I'm in the process of putting Congress and their staff back under the bill, but I'm also including the president, his vice president, and appointees under the bill. I mean, the bill's named after the president. You'd think he'd want to be under it. Well, apparently he doesn't, and he doesn't want anybody else to be under it. But he wants America to have to take the tough pill of Obamacare.
From the White House Office of Health Reform. And the president did a town hall in Portsmouth, New Hampshire the other day, and a lot of people didn't get inside, and they have questions for the White House, so we're trying to answer some of them. And here's one from Bianca.
Hello, my name is Bianca Garcia, and I was just curious because why did Congress vote to exempt themselves from the same health care plan that they want for the American people? That's my question, and I'd appreciate your answer.
Well, Bianca, Congress has not taken a vote to exempt itself from health insurance reform. And what members of Congress have right now is a choice of plans. They can shop around for a plan that works best for them and for their family members. And what Americans, especially Americans who do not have adequate health insurance, are going to get under health insurance reform is exactly that. So under health insurance reform, Americans will have more choices of affordable plans, just as members of Congress do. So, Bianca, I hope that answers your question. And if you have any more questions, please come to whitehouse.gov, where we have a whole series of questions and answers that people have been sending in to us. And I hope that we're answering those questions for you.
Has the president, I know you've been asked about this, but it's been a couple weeks. Has the president signed up for insurance yet?
I have no
updates on that. The president will purchase insurance on the exchanges.
He doesn't have to do it. He doesn't do it by the first.
Obviously, it's the enrollment's till March 31st. So when we have an update on it, we'll provide it to you. But our guidance on that has not changed.
And what exchange will it be, and also will we get a chance to see it?
I just don't have any new information on that beyond what we said in the past, which is that he will.
Live under Obamacare, but Congress won't. Senators, representatives, and their top aides will be able to stay in their current health care system, so they will still get a taxpayer-funded contribution to help pay for their health plans. That's because of a last-minute deal worked out before Congress went on vacation for 5 weeks. The deal gets Congress out of the original language of Obamacare.
Because the president's made it clear he wants to get rid of the Affordable Care Act. He's been running on that, he ran on that, and he's been governing on that. He's in the Supreme Court right now trying to get rid of the Affordable Care Act, which will strip 20 million people from having insurance, health insurance now.
Obama used fake promises like you can keep your doctor to get Obamacare passed. Today, proponents are using fake numbers to try and keep it from being repealed. The administration claims 20 million more Americans today have health care due to Obamacare. But the actual numbers, the real numbers, show a different story. Heritage Foundation experts looked at the net gain, meaning how many people actually signed up for insurance, not just how many people in a survey suggested they would sign up, and found that the real increase is about 14 million people, not the 20 million number you've heard proponents of the law suggest. It's the difference, for example, in how many people actually cast a ballot in an election versus how many people said in a poll the week before they would go to the polls. But back to the real number of 14 million who now have health insurance due to Obamacare. Only 2.3 million are people who signed up for private insurance. 11.8 million, or 84% of the newly insured, were people given Medicaid cards, which is not the same thing as being signed up for quality health care. In fact, it doesn't ensure all those new recipients have health care at all. That's because increasing numbers of doctors and health care providers aren't accepting Medicaid. Additionally, a University of Virginia study found that for 8 different surgical procedures, Medicaid patients were more likely to die than privately insured or even uninsured patients. They were also more likely to suffer complications. Another underreported fact, yet very real number, is how many truly needy and disabled Americans are now not getting the services they need because of the expansion of Medicaid to healthy adults between the ages of 19 to 54. Over 500,000 disabled people suffering from developmental disabilities and traumatic brain injuries are on waiting lists for care. And many of them are on waiting lists because Obamacare gives states more money to enroll new able-bodied adults than it does to take care of the disabled who qualified for Medicaid prior to Obamacare. Finally, according to 2 new studies released by the Congressional Budget Office and another by the chief architect of Obamacare, MIT's Jonathan Gruber, it's estimated that anywhere from 2 to 7 million people now on Medicaid would have qualified for the program even if Obamacare never existed. Washington and politicians are known for stretching the truth, but the numbers don't lie, and Obamacare's 20 million number is fake.
No, despite what some have said, these reforms will not cut your guaranteed benefits. In fact, under this law, Americans on Medicare will receive free preventive care without co-payments or deductibles. That begins this year.
Obamacare has cut $716 billion from Medicare in terms of payments to doctors, hospitals, pharmacies, and other professionals who provide actual medical services. This means that Medicare patients will not have access to the kind and quality of care that they've had in the past.
One of the concerns about health care and how you pay for it, 1/3 of the funding comes from cuts to Medicare. Right. A lot of times, as you know, what happens in Congress is somebody will do something bold, and then Congress, close to election season, will undo it. Right. You saw that with the doc fix. Right. Are you willing to pledge that whatever cuts in Medicare are being made to fund health insurance, 1/3 of it, that you will veto anything that tries to undo that? Yes.
We are looking at 10,000 baby boomers a day for the next 19 years retiring and becoming eligible for Medicare. The Medicare as you've known it is gone. It was killed when the new healthcare law was signed into effect in March of 2010.
Those scary stories about how your benefits will be cut, especially since some of the same folks who are spreading these tall tales have fought against Medicare in the past, and just this year supported a budget that would essentially have turned Medicare into a privatized voucher program. That will not happen on my watch. I will protect Medicare.
Republicans touch the third rail of American politics, President Barack Obama is about to grab on too. He's set to risk the fury of seniors by outlining plans to fight massive deficits by cutting benefit programs like Medicare and Medicaid. But this will not be the GOP plan, which eventually turns Medicare over to private insurance companies and which Obama flatly rejects.
These cuts mean that you won't have the same access to doctors and hospitals that you've had under Medicare as it exists before 2010. Coverage does not mean access to care. If there are no doctors to help you, or if the number of doctors is so far short of our needs, you won't be able to get the care, even though you may have the coverage.
The reforms I'm proposing will strengthen Medicare for future generations without undermining that ironclad guarantee that Medicare represents. We'll reduce our government's Medicare bills by finding new ways to reduce the cost of health care, not by shifting the cost to seniors or the poor or families with disabilities. They are reforms that keep the promise we've made to our seniors, basic security that is rock solid and dependable and there for you when you need it. That's what my budget represents.
My name is Manny Harmon, and I work for MoveOn.org Civic Action. I'm here today representing MoveOn's 8 million members. MoveOn members worked long and hard last November to elect President Barack Obama, and they had the understanding that he would work to protect Social Security and Medicare. But now, President Obama is considering proposing cuts to these vital programs. Under the president's new plan, a typical 80-year-old woman would lose the equivalent of 3 months worth of food every year. That's outrageous. It's unconscionable, and MoveOn members won't stand for it.
Doctors are protesting changes by United Healthcare and say seniors will soon be scrambling to find a new doctor.
Fox 2's Jeff Bernthal explains the insurance company is terminating certain contracts with doctors nationwide, including St. Louis. Jeff?
Nancy and Tom, we are outside the offices of the St. Louis Metropolitan Medical Society. They represent doctors and say they are getting an earful from their members upset over this decision. United Healthcare is terminating Medicare Advantage contracts with doctors. Doctors fear what that means for their patients.
If you put thousands of patients onto those remaining providers, then I would imagine the waits are going to be even longer. And if you have skin cancer, you don't want to wait 2 to 3 months to get it taken care of.
Bob Hughes has skin cancer.
I need to see a doctor, and this is not right.
Starting September 1st, his choices are to pay out-of-network rates, find a new doctor, or change insurance companies, which he can't do until an open enrollment window opens later this year. And finding a new dermatologist may not be so easy.
It's about almost half of the dermatologists in the St. Louis area have been terminated from the plan.
Patients worry about what this all means for them.
Longer wait times, seeing somebody who I may not be comfortable with, who doesn't have the expertise as my current doctor, and I'm just very upset over that.
United Healthcare says patients can apply for continuation of care with an out-of-network physician for a short period of time. The healthcare giant is not saying the cuts are the result of the Affordable Care Act pushed by the president, but they come as government reimbursements to private insurances shrink to offset the costs of the president's plan. In a statement, the healthcare giant says, "We believe these changes will improve the healthcare experience for United Healthcare's Medical Advantage members in the St. Louis area. We understand that any plan changes can be unsettling. We are working to make the transition to a new doctor as smooth as possible, and will do all that we can to prevent interruptions in care."
Maybe if there's enough groundswell in our community, along with others across the nation, maybe United Healthcare will back down on this.
Now, United Healthcare says the changes affect less than 10% of its Medicare Advantage physician network in Missouri. The company says the changes are largely driven by market dynamics.
Biden. And today I want to talk to you in common sense terms about this health insurance debate and the whole question of health insurance reform. Over the course of my career, I built a record of protecting and defending Medicare. I think it's a sacred trust. I stood against the Medicare cuts in the 80s and 90s when others wanted to see Medicare wither on the vine. Remember that phrase? After all these years of defending Medicare, I'm not about to do anything to weaken it, to reduce your benefits, or to hurt the integrity of the Medicare trust fund.
Argued that we should freeze federal spending. I meant Social Security as well. I meant Medicare and Medicaid. I meant Veterans Benefits. I meant every single solitary thing in the government. And I not only tried it once, I tried it twice, I tried it a third time, and I tried it a fourth.
So folks, let's put this in perspective. You've earned those benefits, and we're going to make sure that they're there for you, unencumbered. Look, I know the arguments against government acting to protect your health care. I know what opponents have said. I've heard it before, and so have you. Well, you're hearing the same overheated rhetoric again. We're dealing with the same scare tactics and the same malarkey. Rationing, threats that seniors won't get care, seniors will die sooner. Come on. Enough of the scare tactics. It's time to set the record straight. Look at me. We're not raiding Medicare. We're not cutting guaranteed benefits. Health insurance reform is going to protect Medicare. Not a dollar from the Medicare trust fund will be used to pay for the plan.
One of the concerns about health care and how you pay for it, 1/3 of the funding comes from cuts to Medicare.
Right. This is where the vice president is going to sit down with folks from both parties, both chambers, and we're going to have to just work through how do we put a serious plan together. We may not bridge every difference. There are going to be some areas that are left to the 2012 election debate where we go before the American people and we say, look, what kind of society do we want? And that's a good, healthy debate to have. And I'm going to argue that the kind of society we want is one in which our seniors are protected through Medicare and Medicaid. We have to make sure that we modify the program and drive down health costs overall, but I don't want to just dump all those costs onto seniors.
On Friday, the chief actuary for Medicare and Medicaid came out with a new report that showed that the situation for Medicare is actually a lot worse than was originally thought. Gone so far as to say for our seniors on Medicare, under the Obama health care law, it's going to be that much harder for them to get medical care and to see a doctor. And now we learn that the Department of Health and Human Services has signed a $20 million contract with a private public relations firm to continue to promote this flawed health care law. So today I'm calling on the president to cancel this contract. The American public want real solutions to problems of health care, not more press releases and propaganda paid for with their taxpayer dollars.
Let me also address, I think, a misperception that's been out there, that somehow there is any discussion on Capitol Hill about reducing Medicare benefits. Nobody is talking about reducing Medicare benefits. Medicare benefits are there because people contributed into a system. It works. We don't want to change it. What we do want is to eliminate some of the waste that is being paid for out of the Medicare trust fund that could be used more effectively to cover more people and to strengthen the system.
For President Richard Trumka, our 55-member national unions, and 12 million Americans and their families who work for a living, who supported President Obama for re-election, and who did so in large part because of his promise to protect our social insurance system and to oppose benefit cuts in Social Security, Medicare, and Medicaid.
For millions of Medicare Advantage patients, the Obama administration calling for a reduction in spending that could amount to as much as 3.5% by next year. John Fund is a columnist for National Review magazine, joins us now. John, really great to see you, and I wonder what you think about how big of an issue this will be in the midterm elections in November, Republicans jumping all over it.
Well, and Democrats. I mean, Senator Chuck Schumer and 6 Democrats who are up for election in 2014 have written a letter to the president saying, please don't make these Medicare cuts. It's a surprise to a lot of seniors. 30% of seniors belong to Medicare Advantage. That's a program that is privately managed Medicare. It offers often benefits that traditional Medicare doesn't, like vision and dental and gym memberships and chronic illness treatment. And 90% of people on Medicare Advantage say they like the program. But that's the one part of Medicare that's going to be cut. And the money is apparently going to be transferred to Obamacare to try to help people sign up for the, uninsured. Mm-hmm. And it's basically a shell game to a lot of people looking at this because they're happy with their Medicare Advantage plan, and once again, they're not going to be able to keep it as they envisioned it.
An honest way to come to the Congress is, look, we screwed up. We would destroy Medicare Advantage if we didn't bail it out. So we came up with a scheme to bail it out. That's what you did.
These Medicare cuts were supposed to happen 2 years ago, and then they came up with this demonstration project, and they poured money in to basically delay the cuts. So now the cuts are finally coming due, and they should have taken place in 2012. It wouldn't surprise me at all, Ed, that you're right, that somehow money or something will be found on an executive order to delay these cuts until after the 2014 election, which of course Democrats are worried that the Senate is at stake in.
Medicare Advantage plans are an example of a successful public-private partnership. These plans represent an integrated care delivery model that uses effective provider incentives, real-time clinical information, and care coordination capabilities to improve quality and lower costs.
It is the most effective federal program moving seniors to higher quality care through coordination and measurement of quality and outcomes.
Medicare Advantage is a high quality program. It's very popular. In your districts, it's even more popular than nationwide. The senior population is rising, 10,000 new beneficiaries every day. One would expect that if nothing else changed, you'd see more enrollment, a lot more enrollment. We're going to see less. What's changed is the financial foundation. The cuts under MA are going to make it impossible for plans to survive, and those that survive will have to change their networks and their benefits and their cost sharing in ways that seniors will find undesirable. The net result is going to be less availability of Medicare Advantage.
One of the things that hasn't been discussed is the impact that Obamacare is having on Medicare and Medicare beneficiaries. Obviously, being from Florida, we have a significant number of Medicare beneficiaries, and in particular people that are under something called Medicare Advantage, which is the only program in Medicare where seniors get to choose their coverage, the type of coverage they want, things of that nature. My mom's a Medicare Advantage patient. So I wanted to read briefly, if I could, a letter that I received from a constituent of mine named Michelle Hatley, who lives in Destin, Florida, which is in northwest Florida. And it's a letter that she received regarding her existing doctors. She also got a letter from her one of her providers that talks about the changes that are happening. Let me read you the email. She sent this attached with it. Here's a copy of the letter that I received from White Wilson Medical Group. As I indicated in our conversation, Sacred Heart might be also affected. My Medicare Advantage plan was the Medicare Completer through AARP and the United Healthcare. I have multiple chronic conditions which require treatment and consultation through several doctors. 3 of my doctors are with White Wilson, and 3 are with Sacred Heart. My rheumatologist, who directs my care for treatment of 2 autoimmune conditions, including rheumatoid arthritis, is with Sacred Heart, and the only rheumatologist in Destin. I am also legally blind, so transport to another doctor out of town is both difficult to arrange and expensive. Of the plans that are available that will allow me to keep my doctors, the annual out-of-pocket is significantly higher, as well as the co-payments and the deductibles for patient visits, prescription drugs, and inpatient care. My choice has been reduced to finding all new doctors or enrolling in a different Medicare Advantage plan, which will cost more. I wanted the Senator to be aware that Medicare clients are experiencing negative consequences for from ACA as well. Since that time, by the way, after this experience, she has been able to find a plan that helps her avoid all 6 of her doctors, including the 5 specialists and her primary care physician. But here's the catch. This new plan, its out-of-pocket costs are now going from $4,000 to $4,500 range. It's now going up to an expected $5,900. It was a tough decision for her to make, but she ultimately decided to pay more money in order to keep seeing all her doctors that have been treating her for the past 4 to 6 years. This is a real-life story of a Medicare Advantage recipient in this country whose out-of-pocket costs are going up because of Obamacare. It is wrong. It is unfair. It should not stand.
I'm going to argue that the kind of society we want is one in which our seniors are protected through Medicare and Medicaid. We have to make sure that we modify the program and drive down health costs overall, but I don't want to just dump all those costs onto seniors.
Public life, in my, is politicians just blatantly, repeatedly, baldly, shamelessly lying. Just making stuff up.
It's an honor to introduce Valerie Jarrett, Senior Advisor to President Barack Obama and Assistant to the President for Public Liaison and Intergovernmental Affairs in the Obama administration. Ms. Jarrett serves as the Chair of the White House Council on Women and Girls. Prior to her prominent role in the Obama administration, she was the Chief Executive Officer at the Habitat Company, a real estate development and management company. She also served as co-chair of the Obama-Biden Presidential Transition Team and senior advisor to President Obama's campaign for presidency. Ms. Jarrett has also held positions as the chairman of the Chicago Transit Board, the Commissioner of Planning and Development for the City of Chicago, and Deputy Chief of Staff for Mayor Richard M. Daley. She has also served as chairman of the board of the Chicago Stock Exchange, director of the Federal Reserve Bank of Chicago, and chairman of the University of Chicago Medical Center Board of Trustees. She has also practiced law with 2 private firms.
Working for a president who I have known for decades and who I respect and whose values I share and whose vision for America I embrace, made it a pretty easy choice.
We are here in New York City, joined by folks from around the world, young leaders who have not only identified threats to the democracy, but more importantly, come up with solutions to help strengthen those democracies.
In both your senior advisor role and your public engagement role, the leadership can be subtle, and I'm interested in decision making in that kind of role. And so, for example, I think of 2 interesting decisions. One was the decision to accept calling the ACA, the Affordable Coverage Act, Obamacare, to embrace what it was being called by opponents. And I'm puzzled over, how does a decision like that get made?
I can't remember which senator. One of the senators said when the Republicans first started saying Obamacare like it was a bad thing, affordable health care for everybody. I'm not sure why that's ever considered a bad thing. The senator said, well, Obama does care. And I was like, well, that kind of sounds right. So what's so bad about Obamacare? And finally, he just decided why not embrace it, because they were trying to take something that's very positive and turn it into a negative. And so what better way to kind of dilute that effort than to say, okay, let's call it Obamacare. And in fact, just yesterday he was saying to a group, you know in 5 years they're never going to call it Obamacare anymore because it's going to be working really well and all these people are going to be insured, and so they'll try to find another name for it. March 31st is a date by which you have to sign up, or you're not going to be able to get health insurance for the rest of this year. Enrollment period will be over. And we were trying to drive traffic to our healthcare.gov website. And so we were trying to figure out, well, what's a way? We've been doing all kinds of things. We've had celebrities tweeting on Valentine's Day, and this week is Mom Knows Best. So we have all of these moms of celebrities who are out there talking about the importance of making sure that young people get the coverage that they need. What we wanted was to drive the traffic. And so between Monday and Tuesday, the traffic on the website went up 40%. Mission accomplished. And so the president knew when he was elected, he came in with maximum political capital. And his view is if you have that capital, you can take a risk and you can try to do something you really believe in, even if it's going to be really hard, and you may lose some of that capital. It's worth it. And for him, it was worth it. And I think the history will reflect as the quality of health care in our country greatly improves as a result of the Affordable Care Act, that he was right, that was right calculus.
The Affordable Care Act was passed years ago. It's been through the Supreme Court. Did the administration anticipate either this severity or this duration of opposition to the act?
It
it would be hard to anticipate that they would be behaving the way they are behaving. If you mean the Republicans who are, spending an enormous amount of money. And this is what campaigns come down to often, is how much money these outside groups, these super funds, are willing to spend to distort something which is basically providing affordable health care to all Americans.
It was a collaborative effort. The intent was to make it bipartisan, and the intent was to be open and honest with the American people. Our scoring was put out for everybody to see, because we wanted people to understand before a decision was made what was at stake and what we were trying to accomplish.
Of the other major programs were passed, signed into law. They were ultimately done with both Democrat and Republican votes, and it's very telling that not a single Republican in the House or the Senate ultimately voted for the health care bill.
Democrats have gone crazy.